All right, moms, here we are at the end of the day. We have made it through almost Bloom 2020. I really feel like this panel is going to be the icing on the cake. So thank you for hanging with us today. One of the most special things about our Bloom event is the opportunity to engage with experts in fields and topics that are relevant for motherhood, that are areas of interest for each one of you. And so I am super excited about this final panel because we're going to cover several different topics. You have all submitted some amazing questions for our experts tonight. So want to take a minute and thank Dr. Bob, actually Pediatric Dentist, who is sponsoring this panel. He's one of our presenting sponsors for this event. So we appreciate you, Dr. Bob, and helping us make this event happen. It's just been the best day, and I really do believe this is going to be our grand finale. We're gonna really drill all of you with some hard questions, but you're the experts, so we know that you can handle it. But thank you so much for being with us tonight and sharing your time in the middle of, I know there's other things on TV right now that people may be watching or wanting to watch, but we're so glad for everyone that's joined us here tonight. So without further ado, I'd love to dive right in. Moms that are watching, again, as always, drop your questions in the comments. You've already submitted some great ones, so we're going to start with that. But if at any time you have another question, you can drop it there. We're going to do our very best to get to everyone. But our experts will also have access to this group. So over the next few days, maybe they'll be able to come in and, type an answer to you if we can't get to you. But thanks for sticking with us here at 9 p.m. As moms, this is our wild mom's night out. So we're going to get equipped for motherhood tonight, and we're so excited. But let's begin with Dr. Bob. We're going to talk about the topic of pediatric dentistry, because I know this is your area of expertise. But start with just tell us a little bit about your practice and what you offer families here in Miami.
So, well, first, very happy to be here and continue on with the Miami Moms Collective now. Still getting used to the new name too.
I
So,
know, us too.
but no, I'm a board certified pediatric dentist. My office is in South Miami. We run kind of a little boutique practice there. So we're a little bit more kind of quaint, family oriented type setting. I really enjoy that type of setting for our patients. So it's not kind of a wild and crazy environment. Obviously, I mean, everything that we have to do is pretty tailored to our kids. So it's a nice environment just to have those nice one-on-one experiences. And ultimately our goal is to make sure that parents, or not parents, but patients have parents too. Parents
Right.
and patients have a great experience in the dentist for the first time. So it's again a nice way to cultivate the entrance into dentistry for lifelong dental patients. So
That's
it's
right.
kind of
I have to brag on you for a second in your office. I was there yesterday, actually, stopping by and ran into a friend. And I thought, man, in Miami, when you can run into a friend at the dentist office like this is a small world and this must be a special place. But I was on the phone with someone last week, just one of our partners, and he mentioned, man, my wife told me that I wasn't responsible for taking the kids to the dentist. And he said, I was terrified. I said, this is going to be awful. I have to take these children to the dentist. And he said he had such an amazing experience. So that speaks so highly of your office and your team. I know you guys are doing great work to, like you said, introduce families to a healthy, happy dental experience. So grateful for that.
great to hear. It's great to hear. It's always
Um, Yes. Okay, well, we have some specific questions from moms.
sure.
So one mom says that she has a 3-year-old who's been really good at allowing her to help brush the teeth, but recently, he started to like, no, and covering covering his teeth with his tongue. And she's like, it's just hard to even get started because he refuses. So how can we help our children develop good dental habits?
So it's actually really, really common. We see that a lot. You know, the kids, they start doing that, pushing out with their tongue. Best way, lead by example. I mean, in reality, it's one of those things that and I hear it from lots of parents too. If it's just not you trying to force in there and brush, but hey, we're all brushing together as a family. Maybe we have an older sibling that is brushing with them, or even mom and dad can be brushing with them. Best thing always leading by example and
That's good.
expressing to them how easy it is, and it's not a big deal, but it's something that we have to do, and that's the biggest part as well. And I tell a lot of my parents, this is you can't let them win. Unfortunately, you can't let them win, because then it becomes a learned behavior. So
Right.
it's these things that you show them by modeling, and you just keep up with it and keep up with it, and you just don't quit. It's one of those things you can't quit on it.
Yeah.
Because then you just reinforce it. It's okay if they don't want to do it, then
No,
they
skip
don't do
it.
it. And
Yeah.
fortunately, the other end of not brushing our teeth, nobody wants to get to. So again, leading by example, and showing them how it's done is the best way always.
That's good. That's really good. Talk to us about, I remember this from when we did this previously. You were with us at our birthday bash, and we did a great Q&A with you about dental health. And you talked about the 45-degree angle. I've been very conscious of this lately since then, but talk to us about that.
No, yeah. So it's proper brushing technique. It's actually called the modified Basque brushing technique. Is what we preach and what we teach. And essentially, if you think about it, this is my toothbrush bristles. Most people, they just think we're going to scrub back and forth with a toothbrush in there. But you
Mm-hmm.
actually want to angle those toothbrush bristles at a 45-degree angle into the gums. So you're literally angling up to do the top teeth, and then down to do the bottom teeth. And then you also want to do a nice circular motion with that brushing. So again, it's not just a scrub back and forth.
Right.
And I always reiterate that, because I have tons of parents that they always ask, is the electric toothbrush better? And even though I am a big fan of the electric toothbrush, it's one of these things that the brush doesn't do all the work for you. You still need to do the proper
Right.
technique. Even though it is the electric brush, you are getting a little bit of extra work with the toothbrush, but you got to keep up with the proper brushing technique. But yeah, 45-degree angle into the gums always.
That's good. That's good. We have been working on our 45-degree angle, and I'm really selling her with the Rapunzel electric toothbrush. So
That's
I'm
it.
like, the marketing from Disney is really working, or
The
whoever's doing that.
motivator. That's one of the greatest things with those electric toothbrushes, is they become a motivator, because not only is it a toothbrush,
Yeah.
but it becomes a fun toy as well,
A
which is just
reward. Yeah. It becomes a game, like you said, making it something that, yeah, it's a reward for them. One mom asked that she has a 7-week old, and she's a new mom, so she's very unfamiliar with how dental care for, an infant. What would you recommend, and what kind of best practices should she keep in mind with a newborn?
so it's at 7 months, we should already be seeing some teeth in there. Normally, textbook average is about 6 months for teeth to start to grow in. So for us, the second there are teeth in the mouth, we need to be brushing them, and that's with a regular toothbrush, a little small-headed toothbrush.
Okay.
Also, really recommend we need to be using a fluoridated toothpaste with any teeth that are in the mouth. So second there's teeth in the mouth, we want a fluoridated toothpaste.
Okay.
Now that goes with, we need to use an age appropriate amount of toothpaste. So recommendations by the American Dental Association, the American Academy of Pediatric Dentistry as well, is up into the age of 3, use a little tiny grain of rice size amount of that fluoridated toothpaste. So it's not a ton whatsoever. That way, if baby does swallow, it's okay. You definitely don't even have to take the baby back. If we're nursing at night, or if we're giving a bottle at night, it's okay to go ahead and nurse or give a bottle, and then brush afterwards. You don't necessarily have to go take them back to the bathroom and rinse all of that out. You can wipe a lot of the majority of that out of there. Our biggest thing is we don't want babies to go to bed with milk on the teeth, because that could really increase the chance of some cavities in there.
Great.
But yeah, best practices, got to get in there, got to clean, got to get in there. Now teething's a whole nother story. Teething is not fun.
Said
Both of my
all the
children,
mamas of the world. We all agree with you on that.
yeah, both of my children, luckily, I mean, they weren't too bad on the teething. Unfortunately, when it comes down to teething, Tylenol is kind of your best friend. Obviously, we don't want to be giving a whole bunch of Tylenol every night, all the time. But there are some teething toys out there that work really well. I am a big fan of the cold teething toys. Anything you can kind of put in the freezer and get cold. One that I ended up really, really, really liking is it's actually made by Munchkin, if I remember correctly.
Okay.
But it almost looks like a ring pop. I don't know if anybody if is old enough to
Yeah,
remember ring pops,
of
but
course.
it almost looks like a ring pop. It's got a little ring on it, and then there's a
Round
little
and it's
mesh
flat.
bag.
Yep.
Right, there's a
Uh-huh.
little mesh bag on the top of it
Right.
that you can put, like cold fruits or something in there, or even like a frozen strawberry that they can kind of gnaw on, and that helps out quite a bit, alleviate any of that in there, and it kind of gives them that oral kind of fix, so that it gets their mind off of the actual teething. So it's a really, really, really good thing there.
That's a good tip. I love that. Frozen strawberry too. So I'm like, now we're talking nutrition too. We're just
There we go.
training them up all these ways. That's great. Are there that was one of the questions, was teething products that you recommend. What about like bottles. Are there any bottles? Does that make a difference with the teeth of children, or?
So a bottle a regular bottle, any bottle, and again, I went through this with my kids. There's tons of different manufacturers out there that make tons of different bottles, and there are tons of different shapes. The best recommendation is finding a bottle that is close enough to represent what mommy is, so that babies can actually latch on the bottle and drink milk properly. Now, that's all well and good, but if we're going to give a bottle, we want them off the bottle by age 1. Okay, so you need to be transitioning into like a sippy cup or a cup with a straw. One of my really big favorites is, it's actually another product by Munchkin. I feel like I'm not.
Are you a spokesperson for Munchkin?
I don't get anything from Munchkin, but they make a product that is the 360 cup. I don't know if anybody.
Yeah, with the little rim.
The round one that has like the little kind of top on it. Really, really like that because it doesn't have any kind of spout that sticks up that can put any pressure back behind the front teeth there, which can cause some kind of some orthodontic problems and malocclusion problems. So really, really like that cup. And that's after we transition off the bottle. So my recommendation, if we're going to use a bottle, is just find a bottle that baby likes and baby will use. And then after that, transition them off the bottle into a regular sippy cup with a straw, or even better, that 360 cup would be best.
That's good. What about a mom, and forgive me, I'm looking this way because I'm checking out the comments that moms are asking questions. What about a toddler who may have a sucrose and fructose allergy to toothpaste? Are there toothpastes out there that are allergy friendly, I guess?
There are a lot of toothpastes out there that do not contain any sucrose or fructose.
Okay.
There's a lot of all natural ones. I'm actually currently working on some product development on stuff like that. But yeah, there are a few all natural ones out there. I'm sorry, but I don't remember any right off the top of my head.
Munchkin probably has one, right?
There's a good chance. Munchkin has one. I'll look into it. but no, there's actually quite a number of them that do not contain sucrose and fructose. They'll have other types of sweeteners in there and flavorings. Okay. A really good one to look for is anything that contains xylitol, which is an all natural sweetener. But that it's actually an anti-cavity all natural sweetener, which is why we really like it in a lot of dental products.
Okay, great. Oh, that's good. It's great. Moms have so many good questions. Okay, a couple questions about orthodontics. We know you're not an ortho, but you've got all the training to prepare these children who are headed that way.
Yeah, we work closely with a lot of orthodontists, so I mean, for sure.
Yeah. So seeing children like wear braces and then maybe they remove them and they need to get them again. One mom says that she knows at least one of her daughters who is 7 years old will need braces. From a car accident where she's had some issues, I think. Should she consider braces now, or should she wait until her teen years?
So, I mean, car accident, that's going to be kind of a whole nother scenario. But when it comes down to braces with kids, there are some scenarios where children do need to have some braces put on early. And we call that interceptive orthodontics or phase 1 orthodontics. Because there are some what we call malocclusions, just the way your teeth come together is your occlusion. So a malocclusion would be a misocclusion that need to be corrected when kids are young to take advantage of their growth. And the reason you do that, because then it would either make it extremely difficult to correct that problem later or virtually impossible to correct that problem later.
Right.
So that's why we see a lot of young children going around with certain orthodontic appliances in their mouth. And with those orthodontic appliances, you have to put braces on too. And that's, again, just to really, really take advantage of growth modification to make treatment when kids are older in their teenage years a lot easier or even possible. So early interceptive orthodontics, and the American Academy of Orthodontics and the American Academy of Pediatric Dentists both recommend that children typically by age 7 or at age of 7 have an orthodontic evaluation. And that's a big part of our exams. Every time we see kids that come in for either a new patient exam or a child we've been seeing for many number of years, we always evaluate them to make sure that we get them off to an orthodontist at an appropriate time.
That's good. Wow. I remember first learning that fact and I was surprised. I was like, wow, that seems young, because I just remember middle school days when everybody's getting braces, but that's great to know. So mamas, if you have 6, 7-year-olds, start making those appointments to get those things checked out. And then teeth brushing as soon as that first tooth emerges. All right, let's talk something serious, Dr. Bob. I'm actually going to ask the moms on this because I'm dying to know. But I have a 3-year-old, so we're not losing teeth yet, but won't be long. I want to know what's the going rate for the tooth fairy these days. So moms, if you can put that in the comments, that would be helpful. There'll probably be inflation between now and when she loses her tooth. But on that same vein, how about let's close out with this. Tell us, when a child does have a loose tooth for the first time, what steps do you recommend to removing that? Because I just think I'm terrified when that moment comes. I'm going to be like, husband, you got to deal with this.
So that's something we see it all the time. The biggest thing is the second the teeth start getting loose, I really encourage parents to encourage kids to wiggle the tooth like crazy. Either with a finger, wiggle it, even now with the coronavirus, wash your hands before wiggling,
That's right.
or a little hand sanitizer, but lots and lots of wiggling, either with their tongue or their finger, just to really encourage them. I always have kids come in, the parents, they're a little squeamish about it, and they want us to take the teeth out, which we couldn't do, but I always try and get them to really encourage the wiggling at home. Because kids have 20 baby teeth that need to come out. Okay?
A lot of dentist appointment if they can't handle it.
So it's something that very easy, as long as you keep moving those teeth and get them going. Now, again, there was always certain scenarios that we do need to take those baby teeth out. But in the beginning, I always encourage wiggling. Kids keep wiggling and wiggling and wiggling those teeth. They come out very, very easy when they're ready to. Okay. So there's no necessity in rushing having the baby teeth come out. So if they just start getting wiggly and it's been a month or two, they're not ready to come out yet. It could be 6 months, a year of it being wiggly, depending on the child. Okay. But just because a tooth became wiggly today doesn't mean it needs to be gone tomorrow.
I was thinking, give them an apple, tie a string on it, slam the door, all the ways that we were told as children.
I don't really recommend the string in the door scenario anymore, but eating an apple, biting an apple, great way to do it. Great way to do it.
I love it. Things have changed since the 80s, Dr. Bob.
A little bit. Just a little bit.
Awesome. Well, moms have great questions, and just thank you so much. We know we could spend an hour just talking about this because it's such a great topic. I am going to put a link in the comments later, moms, to a resource where we did do a 1-hour questionnaire with Dr. Bob. And so there'll be more resources for you there. But Dr. Bob, thank you so much for your time. We're so grateful. You're welcome to stay on with us and hear the other panels, or if you need to slip out at any time, we understand. It's getting late and you have a family yourself. So all of you do. So we're going to keep going, but thank you so much for sharing your insights with us about pediatric dentistry.
My absolute pleasure.
Awesome. Well, we're going to transition now. I'm excited to introduce you to Dr. Eddie Martinez of Coconut Grove Chiropractic. I'm really excited about this because I personally have a lot of questions about chiropractic. I'm a pregnant mom and I'm really feeling everything all of a sudden. And I'm like, maybe I need to go get worked out. So moms have submitted some great questions, but Dr. Martinez, thank you so much for being with us. We're very grateful to have you on our panel. And he's born and raised in Miami. So he's been here. He knows this area. He's served on trips all over the world, really amazing places that you've used your expertise. And so he was voted Chiropractor of the Year by his respected peers, the Florida Chiropractic Society in 2009. And he currently serves as the president of the Florida Chiropractic Society. So I know you have a lot of great wisdom to share in terms of your profession, but also love that you have 4 children. So you have lots of wisdom to share there as well. So as mamas, we just welcome you and we're grateful that you're with us tonight.
Thank you for having me on. And we participated, our office participated last year, and I'm grateful to be on here again this year with you guys, for sure.
Awesome. You were with us. We were so thankful for that. So, okay, let's dive right in. We got some great questions. Okay, this is one I'm like, I got to tell my husband that this is doctor's order. So I hope you say yes, but are regular massages good for our bodies, both during pregnancy and long after pregnancy?
Very good question. Probably a better question for a licensed massage therapist, but I'll give you my take on it. My brother is a massage therapist, so okay. It is very helpful, especially if you go to someone that does a prenatal massage. I know they have their parameters and their their guidelines. So I believe it's you have to wait after the first trimester before you start getting massages. But what I can do is answer any questions about chiropractic. So
yes, I'm so sorry about that. I know some offices have both, and so I think
yes,
a mom submitted that question. Let's transition though. Tell us, because what I love about your practice is that you really see the whole family. So talk to us about that, and what does chiropractic look like for, everywhere from, I assume, infant all the way up to, our whole family, our whole lifespan. So talk to us about that.
So funny, I'll give you a little background. I've been in practice 23 years.
Amazing.
And when I first started my own practice, my wife, we were pregnant with our first child, and it just so happens we were looking for like a midwife, that type of thing, and we couldn't find one. And all of a sudden, I got a phone call from a midwife looking for a chiropractor. So it kind of worked out. We went over there, visited her, and fell in love with the place. And we had our 4 kids at that maternity center over.
Amazing.
It used to be in the beach, but now it's in North Miami. But and it kind of, my practice kind of snowballed into taking care of pregnant women because of my relationship with the midwives, and then going into children. We usually most chiropractors are trained to take care of pregnant women and children. When I was in school, there wasn't a big pediatric. There was like a few classes, but it wasn't. So I had to learn, outside. I'm a member of the International Chiropractic Pediatric Association. So we had to go outside and get a little more experience. That relationship that I had with them created this office where my niche was basically seeing families. So I can see, as early as right when they're born. I mean, I can say for my children, I checked them as soon as they were born and adjusted them if they needed it. And other moms will call me a few days after, a few weeks after I check them. I don't usually, if it's not necessary to adjust them, I will not. But I always check them to make sure everything's all right.
That's great. No, that's great. It's something I didn't even realize you could do at that
Sure.
soon, but that it's a great thing to do. One mom says she's heard that regular visits to the chiropractor can help children with speech, like a speech delay. Is that something?
Well, just to give you a little background, again, what we're focusing on, what I focus on in the office is because some people will come in with symptoms or conditions, their pain, and some people would come in because they want to stay well and continue to thrive as far as their health is concerned.
Right.
So we're focusing on the relationship between the position of the spine and how it affects the nervous system. So once you start working with that dynamic and you improve the nerve flow in the body, that it's connected to every organ, tissue, gland in the body, then the body starts to function better, and that's what we want. We want the body to be at a normal functioning. So there's certain things that we've seen in the office that have gotten better. Right. Speech, actually with breastfeeding, the kids being able to latch on better, when we're adjusting, especially on the upper neck.
Oh, wow.
And just to give you another little background, it's not, some people think that it's, I'm twisting and turning the neck around. It's very specific, very light forced adjustments. Some people have a misconception of what exactly it is that we do, right?
Right. Everyone's like, oh.
Yeah.
No, that's good. And I have mom friends who their children had ear infection after ear infection until they went to the chiropractor, and they're like, something happened. So like you said, just that holistic treating the body and everything starts, working better. But
and there is that link between the nervous system and the immune system. So, the stronger and better the immune system is, the nervous system is functioning, the stronger the immune system is, and your body can adapt to the environment.
Correct. Oh, that's great. That's great. Talk to us about, is it safe for pregnant women to be adjusted? Yes.
Well, there's really no contraindication for adjusting. So we can adjust from the moment you find out you're pregnant. I've had families come in, I've seen people, 23 years in practice, I've seen little girls come in as girls with their parents, and all of a sudden now they're pregnant and having their own family. So, it's very safe. There's no contraindications to adjusting or when to adjust. All the way to the end of pregnancy. Some moms come in if they're a little bit overdue, and not that we force things to happen, but the adjustments and getting the pelvis aligned, making sure the pelvis is aligned and there's no constraints on the ligaments, makes room for the baby. and it you know, it prevents a lot of issues from even arising.
That's great. What about one mom, and you a little bit spoke to this, but in terms of like how early a mom can be adjusted postpartum, like really, like you said, there's no delay too much, right?
Right. Well, like I said, you know, you want to make sure that after you have the baby, enjoy your baby.
Yes.
Get that breastfeeding down, and stuff like that, if that's what you're doing. And
right.
and you know, again, enjoy your baby. I've had moms come in right after, and again, there's different techniques, different ways to do it. Very light force. There's different areas we can adjust. You know, so we know what we're doing. We're being very careful as being light and not forcing anything, but we want to make sure that the adjustments, the purpose of them is so that postpartum, you want to make sure that the mom is able to get back to, you know, normal position or even better position than before she was pregnant. So
that's right. Okay, great. Now, what about how often do you recommend that a person get adjusted, or is that a case by case scenario?
It all depends. It all depends. There depending on lifestyle, what type of work you do, what type of stress you have in your life. I personally, I've been getting adjusted since I was 13 years old, and it's just something that is a long story, but something I got into. I got hurt playing football.
Oh, wow.
And as I was going to the chiropractor regularly to take care of my injury, I suffered at that time with a lot of allergies. So that's how I got into this. Basically, it helped me allergies, because at the time we didn't really know what I was allergic to, and they couldn't figure it out. I did all the tests and they couldn't pinpoint it. But as I was going through taking care of one thing, that's what I actually ended up clearing up. So
wow, that's so interesting.
That's my story.
My husband has terrible allergies. Don't tell him I told you. But I'm thinking, man, I know that's something that neither one of us have ever done. And I'm like learning more about it now. I'm like, I think we need to really check this out. That's great. Talk to us about just like what a first visit would look like. Someone who's never been before, walk us through what would it look like coming into your practice and having a visit with you.
Well, it's my office is a very friendly environment. Like I said, Dr. Bob has a unique boutique place. I also have a very unique place where it's, you know, pre-COVID. Since I see a lot of families, a lot of kids, it was, you know, it was just full of people running, you know, kids running around, and everybody was okay with this. We've kind of modified it a little bit. We still get the families in. Typically for an adult, let's say you come in, you get greeted by our front desk, and you go into the exam room. You get to shown a video and give you a little background as far as what we're going to do and what our purpose is. Make sure you're in the right office, and then we go through our exam. So I'll do. I have thermal scans, which basically is a thermometer. Since it's a way to measure the nervous system stress on the body. And it measures up. It's a bilateral thermometer that goes up the spine, and it shows temperature differences along the spine where the nerves exit. So that's one. I'll check posture. I'll feel with my hands, palpate the spine. We'll do bilateral scales where we check the weight difference from side to side on the body. And these are things that we have like a baseline, so we know where we start.
Okay.
We can see how they're corrected. And then there's x-rays. I do like to take x-rays on adults so I can get more information, get really good, pinpoint the position of the vertebra, so it helps me out when we do the adjustments. Now with pregnant women, I usually don't take x-rays, but I use all the other information to gather and so I can make my decisions on that.
Build it. Okay. Wow. Okay. That's so neat. There's a mom in the comments that says that you saw her daughter when she was 1. So she was like, oh, we love their office. He saw my daughter when she was 1. So tell us, are chiropractic visits typically covered by insurance? We're going to get to some more insurance talk here in a minute, but is that something that maybe typically insurance covers?
Yeah, typically the insurance does cover chiropractic care. You know, there's always limitations and stuff like that, but for the most part, most insurances do cover chiropractic.
That's great.
And if not, I've made my office where it's affordable, so families can come in. So we can go either way.
That's great. That's great. Making it accessible for families is Amazing. Wow. Thank you so much. I feel like you have so much expertise to share on that. We do have one specific question from a mom. She said she's dealing with a loss of torsion in her spine. Is that something that getting adjusted could help with?
It can. What I like to compare the adjustments of the spine is basically unlocking the spine so that the body could put itself in the best position possible. So if the body is stuck, whether it's the pelvis or the spine itself, introducing the adjustments or movement into the spine will help free that up. So it can. So again, there's always a case by case basis, but definitely.
That's good. Okay, talk to us. This is one of the things that we're all working to teach our children. And I'm like sitting here going, and I myself need to work on it, but our posture and how that can be something that can affect obviously our chiropractic health, and what can we be doing, just even at home with our children, with ourselves
Yeah, sure. It's a battle with my kids as well. So it's not, I'm not immune to it. Now that most of the stuff is virtual and on computers and on Zoom, we're sitting down a lot with our heads down. So it's always good to, I always try to teach people, even adults, basically try to not sit in the same position for so long. So you want to get up, move around, even if you just stand up at your desk, because when you're concentrating on stuff, you don't want to lose your train of thought. But move around, movement is good. You want to be stuck in the same position. With especially my girls, they'll study on on their bed instead of their desk.
Yeah.
So they're in all crazy positions. And we really want to watch the kids, in their early teens, because that's when, they can develop scoliosis and things like that. So, and that's stuff that we can correct if we catch it. But you want to make sure you do everything you can to prevent that from even happening.
Wow. So those are things that are preventable if caught early.
Yeah.
You
want to make sure you use good posture, good ergonomics on your desk and your chair. But again, a lot of times when you're sitting for 7-8 hours, it's tough. So you want to make sure you get up and move around and reset.
That's good, which we all are doing a lot more of these days, and especially our children, sadly, with a lot of them in virtual school, and like you said, sitting in front of the computer, you don't think how we just kind of sit hunched over like this. So certainly some things to be thinking about. Well, Dr. Martinez, thank you so much. I know you have lots of wisdom to share. I feel terrible cutting our panelists off because we could just keep going and going, but we're just
I'm
so
open
thankful
for questions later, though. That's fine.
Yes. I know you'll engage in the comments with them as well. So moms, if you do have more questions, keep those coming, and we'll be able to circle back in the comments. But Dr. Martinez, thank you for joining us. Thank you for the good work that you're doing, as well as, sharing it. I know I've been on several trips just in other places in the world offering just your skills and services. So it's amazing when you can take what you have been gifted in and share that up with others. So thank you for sharing with us tonight.
Thank you. Appreciate it.
Awesome. All right. We had the question, is chiropractic, is it covered with insurance? So a good segue is, let's talk about some insurance. And we have Joelle Dangerfield with us from Florida Blue. Joelle, thanks so much for being with us tonight.
Thank you.
I have to say, I'll admit, I feel like insurance is overwhelming. It's so overwhelming. Yes. I don't know where to start. I don't know how to understand it all. I have my card and I call the number and I don't even know the questions to ask, but we're going to ask you the questions tonight. So I know you're also a registered nurse with Florida Blue, and then you're in school to become a nurse practitioner, which is awesome. And you yourself have a sweet little baby, 10 months, right?
Mm-hmm.
Oh my goodness. So hopefully maybe you're getting a little sleep by now. I don't know.
Yeah, he's actually doing pretty good. So
good. Oh, that's so great. That's so great. Well, tell us a little bit about, just to begin, about Florida Blue and what you offer moms and families.
So where I work in the retail center, and throughout the state, there's about 31, I think was the last count I had, of centers throughout the state. There's a lot. I'm up in Jacksonville, but there's a lot down in Miami and all down south, located also in the Sanitas clinics as well. Awesome. And we in the center see members and even non-members, but for members, we offer them free health assessments. So we check cholesterol, we do diabetes screenings, we do health fairs throughout the year, and we offer free fitness classes. And that's for the community too, not even just for members.
Okay.
For
And
moms,
these happen at the centers, is that right? You're saying these are happening at those centers?
yeah, everything is in the center. The centers are big enough to have, we offer free yoga, Zumba, Tai Chi, tons of classes, and they're actually all being done by Zoom right now since we're all working from home.
Right.
Yeah. But for moms specifically, expecting moms, we have a great program. It's called our Healthy Additions program. So it's a free program for pregnant mothers, whether it's your first child or if you have children already. So basically, it's a group of nurses who will reach out to you during different, basically once they see the claim that you're pregnant and you've been seeing your doctor for that, they'll reach out to you, making sure that you're seeing your doctor like you should be, making sure that you know when to add the baby once the baby's born, and the good benefits like the free breast pump. So each mom per delivery, so you can get a free new breast pump after each delivery. Yeah, either manual or electric. So there's lots of different choices. The choices keep growing, so there's lots of options for that.
Awesome. And tell me how I even access all that. Do I need to go to the website? Do I need to call on my card? How can moms access these amazing benefits?
So either through a member website. So once you become a member, they can sign in to floridablue.com and all that is there. And then also, calling our customer service, calling any one of the retail centers. You're more likely, if you call one of our retail centers, you're more likely to actually get one of like a person right away who's local to you as well. So once all this is over and we're all back in the center, then you can come back and actually sit one-on-one with somebody and they can help refer them. And most of our centers have nurses in them. So they can get you basically set up with that immediately.
Awesome. Great. We did receive a few like specific questions about insurance, because I think I'm not alone when people are like, oh, we just have a hard time, understanding it all. Yeah. But talk to us about the main difference between an HMO and a PPO.
Okay. Yes. Lots of confusion.
Like, oh, okay.
So an HMO and a PPO, all these acronyms that go around the insurance world. Right. So an HMO and a PPO, basically, in general, they each have their own network of hospitals and doctors and other healthcare professionals. But the biggest difference is how you interact with them. So with an HMO, you have your primary care physician and you go to them. And if you have a specific problem, they will have to refer you out to see a specialist if they can't help you with that. With a PPO, you kind of have more free range of seeing specialists. You don't have to get a referral basically to see specialists. So you don't have to see them first. Yeah. Okay. So for someone who already sees a lot of specialists, a PPO is more for them. While if someone, they want coordinated care through one doctor, then an HMO would kind of be better for them that way.
Best fit. So it's kind of like the two plan options of based on, if you're someone who, like you said, needs to see more specialists, then the PPO is probably better for you. It's great. Okay. Yeah. We throw around these acronyms and we're like, I don't know what they stand for, but that's great. Okay. Now what about, you spoke a little bit about, wellness perks and discounts, but some moms have said, like, is it true that we can get discounts on like everyday health and wellness purchases? And if so, like, what are some examples of those?
Yes. So I, even being a member, I forget about some of these too. I will order something and I'll be like, oh, dang, I could have gotten a discount on that. But we have, so one of the first ones we have is called our Better You Reward. So for this one, it allows members to earn money towards their premium. So with COVID and everything, they've increased the amount that they can earn, but basically it's through the website. They complete a health assessment and then complete other wellness activities on like stress and blood pressure and exercise. And once they complete those, depending on what kind of plan they have, they can earn between $300 to $500 towards their premium, which is a good chunk of change.
Yeah, every little helps for sure.
Yes,
for sure.
And the other one that is more towards like discounts on everyday items is called our Blue 365, which is just through blue365.com. And it's also accessible through the Florida Blue member page. But that is everything from clothing and shoes like Reebok and Skechers, fitness streaming services, smartwatches, wearables, personal care items like Philips Advent bottles, which are what my son uses. And I always forget that I can get a discount on those.
Yeah.
And also on Philips oral care products too.
You got any Munchkin products there on that list?
There may be. And then also meal programs like Nutrisystem and Jenny Craig, discounts on those, and hotels. So pretty much everything.
Okay, time out. That's a lot of things. You just said bottles and hotels and smartwatches. My question is, so if I have Florida Blue insurance, do I immediately have access to all of that, or is that like an added something that I need to get on my plan?
Nope. So that's included. That's for Florida Blue members. Yes. And there's so many more that I didn't even mention.
Okay. So moms are like running to their wallet to go, what is our insurance again? Like, I'm going to go get some Skechers. No, that's amazing. Yeah. Wow. Yeah, definitely a perk that moms are like, whoa, that's amazing. Perks that we didn't realize. It's amazing. All those things that are available there. So you said the member website is a good place to start to see all of those things. And
oh yes.
Yeah. Okay, great. Talk to us about open enrollment. Like explain, like maybe people don't have Florida Blue. What is open enrollment? What does that mean? I know it's coming up. It's usually is it usually November? Is that like an insurance thing that it's always in November?
Yeah. So
really, I don't know that much about insurance. So glad you're here, Joelle.
Yes. So open enrollment is basically the time when it, opens up for everyone to be able to get their health insurance set up for the following year. Look at different plans, see what's right for them. Especially when it comes towards having a family and looking at plans, you want to make sure that you're going to have the right coverage, not only for you, but making sure your kids have the right coverage for their visits with pediatricians and any additional services that they may need. So sitting down with someone, which is why a lot of people like to come to our centers, because they can sit face to face with somebody. A little bit different this year. But I think everyone likes that kind of one-on-one with trying to find the right plan for them. And that's what's nice, is being able to talk to someone. They can kind of narrow that down. It's not like you're going to a website and it's overwhelming. So basically it's just the time to research what you need, what works best for you.
Yeah, great. Okay, so moms, if you're listening in and you heard all those great perks and you're thinking, well, my insurance doesn't do that, you can check out earlier today. We posted some specific things about Florida Blue, and there's some links there to learn more. But Joelle, thanks for making just clarity for us on some of these terms that we're not super familiar with, unless we handle the insurance for our family. Clearly, that's something my husband does for us. I'm very grateful. But we appreciate your expertise tonight. And especially as we're learning, chiropractic services and Dr. Bob, but having the right insurance so that you can see, the best providers is very important. So thanks so much for being with us.
Oh, yes. Thank you.
Awesome. And all the best on your sweet 10-month-old. It's a sweet stage. 10 months. It's really sweet because they start doing things and responding a lot and playing and getting into everything. So I know it's a sweet time.
Yes, it's fun.
That's awesome. Thanks, Joelle. All right. Well, we're going to transition. Hey, mamas, thanks for hanging with us. Keep those questions coming. We are going to now transition to our just final panelist of the evening, Reana Myers. We're so thankful that you're with us.
Thank you for having me.
Yes, of course. She is a PA specializing in aesthetic medicine at Careaga Plastic Surgery. She was born in Albania, which is amazing, and moved to the United States when she was young. And she got her master's degree in medical science. And then she started her career actually in cardiovascular medicine, which is interesting. I would love to know how you made the transition, but then transitioned to the field of plastic surgery. And so now she's got more than 10 years experience there. So thank you for joining us. Moms have lots of questions about this topic. So we're excited to share with you, but tell us, how did you make that transition from cardiovascular to plastic surgery?
Well, I'm glad to be here. Thank you for having me. I went into cardiovascular initially. I worked for 10 years and I loved it, but plastics and dermatology were always in the back of my mind, even when I did my rotations and my training. So when I had my third child, I decided to make the move, the on-call, the ER call. I was on heart attack call, was getting a little out of hand, and it got busier and busier. So during my maternity leave, I made the change.
Oh, I love it. I love that it was your family that kind of directed you in that way. We can all relate to that.
Absolutely. I wanted to spend more time with them and still do something that I love, and it was the best decision.
Oh, that's so great. Well, tell us a little bit more just about Careaga Plastic Surgery and what you provide for local moms. I know you have a lot of different services that I was unfamiliar with. Learned that you also do, prenatal massage and skin treatment. So tell us kind of the whole gamut of what you guys do there.
Absolutely. So we are a state-of-the-art office. We're located in the heart of Coral Gables. Our founder, Dr. Daniel Careaga, an amazing plastic surgeon. We also have Dr. Duran. So they specialize in surgery, body, face, mommy makeovers. I run mostly the spa side of the office. So I do all the injectables, lasers, and our esthetician, Vicky, she does massages. She's incredible, facials, laser hair removal. So we have every possible procedure, surgical and non-surgical, that you can imagine.
Yeah. Wow. Can you tell us a little bit more, because it's specifically your area, but about the non-surgical options that you offer? Maybe we can get a little bit more into like injectables and things like this that moms really have questions about.
Absolutely. So the non-surgical aesthetics have developed tremendously in the last few years. Of course, the injectables such as Botox, fillers. We do a lot of PRP, microneedling, sclerotherapy, which is a problem that women have in general, especially with multiple pregnancies and hormones. So that's another area that I get very busy with.
I'm sorry to interrupt you, but we did receive some questions about that. Can you speak a little bit more specifically to the moms who may not know what that is?
So sclerotherapy is the treatment of varicose vein or spider veins. We are predisposed genetically to get them, so we might hit the genetics jackpot and not get them, but most women in general, hormones, if we sit for prolonged periods of time, or if we stand, we're predisposed to getting spider veins. So what sclerotherapy does is we inject a solution, and we have different solutions that we can inject. When they're injected in the vein, it collapses the vein and it permanently closes it, so it gets rid of spider veins. Oh, wow. Since we're genetically predisposed to them, it's not something that you do once. This maintenance sometimes is required. New spider veins might appear, but it's very effective, and it's an in-office procedure. There's really no downtime. You can go home, you can do your regular routine. It's just little things to avoid sun, beach for 2-3 weeks afterwards.
Okay, great. I'm sorry to interrupt you on that. That was
no, please.
Okay, wait, let's hone in there while you're there. Great. Okay, so in terms of like more of the non-surgical things, injectables, talk to moms about that. Like, what does recovery time look like? There is
really no recovery time, which makes injectables so appealing and so amazing. I do probably Botox. It's one of my most common procedures I do every day. I think it's the #1 aesthetic procedure, non-surgical, in the US, due to its high effectiveness, the high satisfaction rate, minimal side effects, if any, and no downtime. So what Botox does, it temporarily improves the wrinkles of the forehead mostly. And of course, fillers. They're made of hyaluronic acid most commonly. We have other type of fillers like biostimulatory, where they can be injected in the mid or lower face in order to improve lines, moderate to severe lines and wrinkles.
Okay. And is it a case by case sort of thing in terms of how often you need to, like, maybe you have a treatment tomorrow, and then when do you need another one?
Absolutely. So all these treatments are individualized based on your anatomy, the type of wrinkles, based on your desire of what you're trying to achieve. There's different injectors. I probably fall in the conservative natural injector category. I don't like to overdo. I feel that we just need to improve and just refresh instead of just start changing and overdoing. So every treatment is individualized. Botox, most of the patients will get it anywhere between 4 to 6 months. And fillers last a little bit longer. So it's anywhere between once a year to maybe twice a year, depending on the area that we're also injecting.
And the difference between the Botox and the fillers is just what it is that you're.
Very good question. So Botox, what it does, it relaxes the muscle. So when in the face, the muscles are different from the rest of our body. The muscles are attached to skin. So when the muscle moves, the skin bundles with it. So with repetition, when we raise our brows, when we frown, I frown a lot because of my kids. So that repetition will create those lines. So Botox temporarily removes or softens the movement of the muscle. Filler, on the other hand, we're just filling. So usually I use it for the nasolabial folds, for the cheeks, lips.
Okay.
So it's more of a gel-like substance.
Okay. All right. We're getting a couple questions from the mom. So I'm going to jump. I keep looking over here, but I'm jumping to the comments. One said, is it true that both, I guess, fillers and Botox can help with migraines? Is there like a correlation there?
Fillers, not as much, but Botox, absolutely. It's proven to medically help with migraines. I have patients that come to my office that do it specifically for migraines. Absolutely. Fillers, I believe that they don't, but Botox, absolutely, yes.
Okay. All right. Let's see. Another mom is asking about non-surgical liposuction. Does that work? She said, I'm not exactly sure what the procedure is called, but I've seen that many women are getting it.
So I like that, non-surgical liposuction. So what I think they're referring to is the non-surgical fat reduction procedures that we do. So specifically, we offer that in my office. One of them is Careaga. Careaga is an injectable. It's an acid that when injected in the fat tissue, it dissolves it. It was initially FDA approved for the submental area, but to tell you the truth, I have patients that come and I've injected everywhere in the body, including the abdomen, inner thighs, arms, the axillary fat, or also known as the bra fat. So it works great. The other one is a laser. It's called sculpture. So what sculpture does when applied directly to the area that we're trying to target, it increases the temperature of the fat cells. And these fat cells are very susceptible to any temperature changes. So they just die. So sculpture is also a very popular procedure that I do in the office, and it works amazing. Of course, with any non-surgical procedures, several sessions might be necessary to achieve the goal and the results that the patient would desire. But it works, and it can be used pretty much submental area, abdomen, back, flanks, thighs, arms.
Okay. All right. What about in terms of that procedure? One mom is asking if she has a hormone imbalance that makes her prone to weight gain. Is it, would you still recommend that kind of procedure?
So all these procedures should not be considered as a weight loss procedure. So whether it's sculpture, whether it's Careaga, I sometimes have patients and they tell me, if I have 3 sessions of sculpture, how much weight am I going to lose? So this is absolutely not intended to be a weight loss procedure. Okay. So this is just to target the stubborn areas of fat that when we exercise, when we diet, and we still cannot get rid of the fat. So absolutely, when someone has a hormonal imbalance, that should be addressed first. We have a weight loss program in our office. It's a medical weight loss program. And the first thing that I check before I even start the program is hormones, including the thyroid, because that imbalance is going to make the weight loss so much harder, if possible at all. And until those hormones are completely balanced and under control, it's going to make it harder.
Right. Okay, good. One mom asked, I think kind of an add-on to that, but can you still get good goals with non-surgical procedures without exercise? But I think you spoke to that because it's not.
Yeah, exercise, all this lifestyle changes are important. Even with surgical procedures, you can have full body lipo, and if you don't exercise in your diet, you still can gain weight. Unfortunately, these procedures don't take all the fat cells. We're predisposed with a number of cells, of fat cells when we're born. So if we gain weight, even with surgical like lipo and tummy tucks, that's going to change your results. So with any procedure, surgical and non-surgical, diet and exercise should be hand in hand.
Yeah, that's great. Great advice. Okay, talking a little bit about skincare. A few questions came in about that. What are the best treatments for diminishing scars and then also reducing or decreasing sunspots? That's a real issue here in South Florida. So
absolutely. So I'll start with the scars. I have a few lasers in the office, and depending on the type of scars, I choose the laser that is appropriate for the patient. So what are different types of scars? Acne scars, surgical scars. Those are probably the most important. I even treat stretch marks with the lasers. So the different laser that I choose also depends on the type of patient, their type of skin, the scale, the pigment of the skin. So there's different things I take into consideration when I do the lasers, but they work great. Unfortunately, scars never will go away completely 100%, but what we're trying to do is just make them look better, less visible, and of course set expectation with the patient. Now, when it comes to pigmentation, we're always exposed to the sun. So we are unfortunately have to be a little bit more aggressive with keeping it under control. Sunscreen is the best thing that you can do in order to prevent. Prevention is always key when it comes to everything. And
mamas, put that sunscreen on and cover those children.
Sunscreen, that's the best treatment that will avoid aging, wrinkles, pigmentation in the face. So that's the best thing that you can do and the best investment. The laser, and it's technically not, it's a light-based energy. I use the IPL for pigmentation, whether it's sunspots, whether it's even for melasma. There's no cure for melasma, but it does improve. And also rosacea falls in the category of treatments to treat with the IPL.
Okay. All right. Great. Wow. Well, the moms have lots of questions. I kind of want to wrap up with this one, Reana, because I love one of the things that you said is that, each client is unique and you're really working to, not just restructure and recreate everything, but, our bodies were designed in a good way. And so it's, like you said, just helping enhance those things and where you can. But tell me, what do you wish people knew about aesthetic medicine?
So it's because it has changed. It used to be taboo. No, people didn't like to talk too much about it. It has evolved a lot. And we're here to make us women feel better, look better. When we look better, we feel better. And there's more to aesthetics than big lips and looking unnatural and overdone. You can take care of yourself, your skin, facials, just an overall feel better about yourself. So don't be scared. You can come to my office. We do consultations. We can sit down. We can have a treatment plan. It doesn't have to be Botox and injectables. I know a lot of patients are very sometimes reserved about those treatments, but we offer an array of treatments that just to make your skin in general look healthier, feel better about yourselves. So aesthetics has evolved and it's about prevention now. It's not just about getting treatments done.
That's good. That's great. And moms who are listening in, if you purchase a VIP ticket, so you received VIP swag bags, there's a $75 gift card in your VIP swag bags for a service here at Reana's office. So definitely something worth checking out. Like she said, lots of skin treatment options, massages, all of that. Any final thoughts just on like a skin routine? I know you said sunscreen. This is number one.
So sunscreen is number one. When it comes to skin, I don't have time. I have 3 kids. So for me, to simplify things, it's easier in order for my patients to even comply with a routine. So the key products that I always recommend is your sunscreen, your retinol, your antioxidant, and your moisturizer. So if you have those, then you'll be fine.
Okay. And I bet you probably offer those at your office if we don't have those.
Yes, absolutely. Absolutely.
We can check those out there. Oh, well, Reana, thank you so much for being with us
Thank
tonight.
you. Thank you for having me. And I love the questions. Very good question.
Thank you. Thank you all for joining us so late tonight. We're very, very grateful for your time and expertise. Again, mamas, put all those questions in the comments, and our grand prize giveaways, you can see in the caption. I'll share more about what those are, but related here to our expert panels. But Dr. Martinez, we appreciate you so much. Thank you. And Joelle, thanks for being with us. Of course, Reana and Dr. Bob, we appreciate you for hanging with us, all of you late tonight. So we are just grateful that you joined us for Bloom 2020. Have a wonderful, wonderful evening. Thank you, everyone.